So yes, good evening, Mudassir, Azala, virtual reality. Good evening, good evening, Sabrina Mohabbati. Good evening, guys. I hope I'm audible to everyone. The visuals and audios are perfectly fine. So just give me a thumbs up in the chat box if everything is fine. So yes, Dandelion, Naveen Sharma, Meteskio, Vatsala Ojha, good evening, guys. Kashmir, Sabrina, Jia. Okay, perfect, guys. Hina Kauser, yes, good evening, guys. So today I'm gonna discuss a very important topic. Yes, Parth Patel, good evening, beta. Sabrina Deepak V, good evening. So today I'm gonna discuss a very important topic in general anatomy, that is the joints. And guys, see, it's very important. Please put $2, $3 signs, right? $1 over here, it is equal to $1,000 because this topic is asked in every exam. Yes, yes. I'm fine, guys. Game fame, yes. Medescu, Vatsala, very good. Vatsala, okay. Yes, perfectly fine. So this is a topic like in every NEET PG, FMG exam, like one or two questions are expected from this topic. So I want every one of you to be with me throughout the lecture, write the notes, draw the diagrams, see the pictures because now recently also in the NEET PG latest exam they have just given a picture and they have simply asked which type of joint it is. So yes, guys, you will, Sashikant, hello. So you will expect one or two questions from this particular topic. And if you personally ask me in the entire general anatomy, the most important topic which you can't like forget to miss, that is the joints wala part. You have to be very thorough with this particular topic. So yes, Kiran, good evening. Shubham Yadav, yes, from Nepal, perfectly fine. So yeah, let's start with the class. That is the joints. That is the joints. So, sure. Before starting, just give me a thumbs up if the audio and visuals are perfectly fine. So I'm just waiting for your thumbs up, guys. Just give me a thumbs up. Please interact with me throughout the session. Otherwise, it will be like a very boring class, no? If you don't, guys, interact. Medescu, Hina, perfect. Chale. Kashmir, Shubham, perfect, guys. Yes, sure. Let's start with the very basic term. Sabrina, Vatsala, chal. Parth Patel, perfect. Now let us first start with the definition of the joints. Abhijit Sharma, yes, Moon, very good. Now let us first start with the definition of joints. Definition of joints. Yeah, very basic. I hope yes, you guys know all this. Root, yes. Kiran, yeah. Kishore, hi. Now can anyone tell me the definition, guys? See, joint is also called as articulation. In other words, the joint it is also called as the articulation, right? The articulation. Yes, joint is also called as the articulation. Now, guys, a joint or articulation, it is the meeting, okay, of, yeah, please write down. It is the meeting of two or more bones, right? It is the meeting of two or more bones of the skeleton. Now, in the skeleton, you guys already know we have 206 bones, right? 206 bones in our body. And whenever two or more bones will meet with each other, it will result in the joint formation, right? So over here, one thing that you have to be very much clear that movement can be present, right? Yes, Moon, you're right. Yes, the movement may be present, right? The movement may be present or movement may be absent. Movement may be absent at that particular joint, right? So it's a very basic definition where two or more bones will meet. It will result in the formation of a joint. And this joint can be a movable or it can be an immovable joint, right? Now, coming on to the next term, that is the classification of joints. Coming on to the next term, that is the classification of the joints. Now, guys, remember that the joints are classified, right? Over here, the joints are classified according to the nature of tissue present between them, right? According to the nature of the tissue present between them, okay, or present between them, or you can simply write present between the articulating bones, right? Yes, Moon, good. Present between the articulating bones, present between the articulating bones. So yes, it is classified according to the nature of tissue present between the articulating bones, and especially they are classified into three types, guys. Very, very important. They are classified into three types, right? Now, three types over here, guys. Please try to draw the same flowchart I will be drawing with you, right? Yeah, try to draw it in the same manner, guys, because I will be adding something later on this particular slide as well. So yes, they are classified into three types depending on the nature of the tissue present. And please be very clear with the terms, guys. Yes, the very first one, it is the fibrous joints. The fibrous joints, right? The fibrous joints, cartilaginous joints, cartilaginous joints, and the third one, that is again the most important one, that is the synovial joints. That is the synovial joints. So joints are classified into three types depending on the nature of tissue present. We have fibrous, cartilaginous, and synovial joints. And synovial joints. So now guys, now guys, I am going to start one by one each category, and let us first pen down the very important one, that is the fibrous joints. So please leave half of a page over here. I will be writing it when we will be discussing all the joints in detail, right? We will fill the flowchart over here. As of now, just leave the half page. So, and put the next heading as the fibrous joints. Put the next heading as the fibrous joints. Now guys, firstly, we have to discuss the characteristics of these fibrous joints. Characteristics or the characters, just yes, or the characters. Yes, the characters of this fibrous joints. Now, okay, can anyone tell me just by the name, guys, which type of tissue will be present in between the bones, in between the articulating bones? I want the answers by everyone. Just between the bones, which tissue will be present? Yes. So, anyone? Yes. Mohabbati, very good, beta. It is the fibrous tissue. Yes, it is the fibrous tissue. What about rest, guys? Amina, very good. Yeah, it is a connective tissue. Yeah, it is a connective tissue. Or I can simply say the opposed bony surfaces. Okay, the opposed bony surfaces are connected together by fibrous tissue. Are connected together by fibrous tissue. Yes, Alicia. Yes, Sindhu Shri. Hi, Virish. Yes, yes, yes. It is present at the cranium. Yes. So yes, it is connected by the fibrous tissue, right? Apart from that, guys, two more points that you have to remember. In first, the characteristics, guys. See, obviously there will be opposed bony surfaces, means there will be two bones joining, and in between the joint you will get some fibrous tissue. Apart from that, guys, you should remember that there is no joint cavity. Very, very important. There is no joint cavity over here, right? There is no joint cavity between the articulating bones. Between the articulating bones. There is no joint cavity between the articulating bones. Apart from that, one important point that Sabrina Mohabbati has already written, that is there is no movement. Okay, or we can simply say that no movement is allowed. Yes, no movement is allowed between the articulating bones. No movement is allowed between the articulating bones. Yes, very, very important. The three important characters that I have discussed over here. Basically, the bones will be connected by some fibrous tissue. There will be no joint cavity, there will be no movement. Now, guys, when I say fibrous, what comes in your mind? The very first thing that comes in your mind, guys. Can anyone tell me? Yes. Fibrous का मतलब क्या होता है? Hard, right? So these joints are very very hard. So obviously there will be no movement, right? There will be no movement. Yes, Mahapati, very good. Yes, Azala, perfect. Now, guys, again the classification of the fibrous joints, very very important. Yes, the classification. See, the fibrous joints are classified into three types. It is classified into three categories, guys. It is classified into three categories. Now, the very first one, it is, yes, the sutural joints. Yes, the sutural joints. Okay, nine names might be no very hard as of now, but yeah, please just try to write. If you write along with me, if you learn, and it becomes a piece of cake, right? The second one, it is, be very clear with the spellings. It is Syndesmosis, guys. It is Syndesmosis. And the third one, guys, it is the gomphosis. It is the gomphosis, right? It is the gomphosis. So we have the sutural joints, the syndesmosis, and the gomphosis, right? Yes, Kashmir, very good, guys. Right. Now, guys, let us discuss one by one all the joints, right? All the joints. Now, the very first one, yes, the very first one, we have sutural fibrous joints. Sutural fibrous joints. Now, over here, guys, remember that these, now, again, when I say sutural fibrous joints, guys, they occur, or these joints are actually, yes, these joints occurs between the flat bones. Okay, these joints occur. Yes, Mad Machine, you are right. Mad Machine, you are right. They occur between the flat bones of the body. Okay, the flat bones. Okay, and the example, guys, you already know the flat bone. Yes, that is the skull bones. Yes, you guys are right. Yes, Kashmir, very good. Dr. Tudu, very good. It is the skull bones, guys. It is the skull bones. It is the skull bones, right? It is the skull bones. Now, now you now see over here. Yeah, let us start with the classification over here. The very first one of sutural fibrous joints. Yes, the very first one of the sutural fibrous joints. Yes, it is the plain suture joints. The plain suture joints. Yes, the plain suture joints. Obviously, they are not mobile. Mad Machine, I have already told it. No movement is allowed between the articulating bones, right? Yes, the articulating bones. Now, okay, the plain suture joints, guys. Okay, so the very first one, guys, over here. Now, when I say plane, guys, when I say plane, so the articulating surfaces are actually plane. The articulating surfaces are actually plane, or I can simply say that there is simple apposition. Okay, there is simple apposition between the bony edges. Between the bony edges. Yes, yes, Amina. There is simple apposition between the bony edges. Now, guys, just let us try to draw this. Let us try to draw this. You guys already know that. Let us suppose that this is the bone 1. Let us just simply try to draw this. This is bone 1. Yes, this is bone 1. This is the articulating end of the bone 1. And yeah, we have bone 2 also. Yes, we have bone 2 also over here. Hmm. And you guys already know between bone 1 and bone 2. Yes, we have bone 1 and bone 2. Bone 2, right? And in between the bones, yes, this yellow color which I'm highlighting, can anyone tell me what is present between these two bones? Right, can anyone tell me what is present in between these bones? Sure. Yes, bone 1 and bone 2. Yes, Amina, very good. It is the fibrous tissue, but which type? Yeah, it is the sutural ligament, guys. Right? It is a, yes, very, very important. It is the sutural ligament. Right? The sutural ligament, that is again a fibrous tissue only. Yes, everyone is right. Abhijit, right. Mad Machine, right. It is the sutural ligament or the fibrous tissue. Yes. Now, examples are very, very important. Examples are very, very important, guys. Yes. The examples of the plain suture joints. The very first one, guys. It is the internasal suture. Internasal suture. Okay. The second one, intermaxillary suture. Intermaxillary suture. And the third one, guys. Yes. The interpalatine suture. Interpalatine suture. Okay. Now, when I say inter का मतलब क्या होता है? What is meant by the term inter, guys? You guys already know कि, for example, there is one cell and there is another cell. Now, when I say inter means in between the cell. Intercellular. You might have heard the term intercellular, guys. Now, when I say inter, it is between the cells, right? So, internasal suture will be present between which two bones, guys? I want your answers in the in the comment section. Internasal sutures will be present between which two bones, guys? Sure. Yes. Amina, very good. The nasal bones, guys. Yes, the nasal bones. Let me show you an image, guys, over here. Now, this is which view of the skull, guys? Yes, everyone is right. Sabrina, Mad Machine. Yes, Amina, right. Yeah. Now, this is which view of the skull? You guys already know that this is the anterior view of the skull. This is the anterior view of the skull, right? The anterior view of the skull. Now, when I say internasal, guys, you can see the nasal bones, right? This is the nasal bones. These two are actually the nasal bones, right? Now, there are two nasal bones. According to this is the right side and this is the left side. So, the two nasal bones, yes, yeah, the two nasal bones are basically connected. Yes, you guys are right. The two nasal bones are connected together. Okay, and this is a joint which I'm showing with the green color, guys. Yes, this is the plain sutural joint. Okay, it is a plain sutural joint, or I can simply say the internasal joint. Inter means between the two nasal bones. Internasal joints. Internasal joint, right? The internasal joint, right? The two nasal bones. The right nasal bone and the left nasal bone. Now coming on to the next example, guys, you can see very well the maxilla, right? You can see the maxilla, or yeah, let me write it with this. Yes, the maxilla. We have the maxilla, and maxilla is also left and right. So the right and the left maxilla, they are also connected to each other, right? They are also connected to each other with the help of, yeah, it's a type of plain sutural joint. Plain sutural joint, or I can simply say, yeah, it's actually the intermaxillary joint. Intermaxillary joint. Yes, it is the intermaxillary joint, guys. It is the intermaxillary joint. So I hope the plain sutural joint is clear. Yeah, पेन का width तो यार अभी इतना ही रहेगा. So I hope this is clear. The intermaxillary joint, it is clear to everyone, guys, right? So just give me a thumbs up if you understood this the plain suture joints, the plain suture joints. Yes, spring hearts, we'll come to that also. Yes, so we have already discussed this. Yes, intermaxillary suture, yeah, the joint, right. We'll come to shindylesis and everything. Now coming on to the next category, guys, over here. Yes, we have the serrate suture joints, right? The second one, yes. So we have discussed the plain suture joints. Now the second one, guys, the second one, the B, that is the serrate suture joints. Yes, intermaxillary joint is a type of plain suture joint, right? The serrate suture joints. The serrate suture joints. Now let us discuss. Now when I say yeah, the serrate suture. Now obviously in this category we are talking about the bony margins. We are talking about the bony margins, right? Yes. Abhijit, you are right. Now over here, guys, remember. Yes, over here, remember these joints, right? The serrate suture joints, basically the bony margins have saw-like edges, have saw-like edges. The bony margins have saw-like edges, right? So now when I say let us just try to draw a diagram, and yes, let us just try to draw a diagram and see, guys, how does it looks like. Now let me draw bone 1, right? So yes, it is just like this, guys. Serrate sutures. So yes, this is bone 1, right? And yeah, let me draw bone 2 as well. We have two bones over here. So these two bones are joined together with the help of these saw-like edges, right? So this is bone 1 and this is bone 2. Bone 2, and their margins, their articulating surfaces are having saw-like appearances, saw-like edges. And in between, guys, which ligament will be there? Can anyone tell me which ligament will be present over here in the yellow color? Yes. Good evening. Good evening, Rizia. Yes. Which ligament will be present, guys? Yes, it is the sutural ligament, guys. It is the sutural ligament. Sutural ligament, guys. Yes. It is the sutural ligament. And guys, the examples again are very important. Yes, the examples are very important. Yeah, the very first one that you have to remember, and the only one in this case, that is the sagittal suture. That is the sagittal suture. Now, when I say sagittal, guys, there is a plane called as sagittal plane. Now, you guys are going to tell me the sagittal plane. What is the definition of a sagittal plane, guys? What is the definition of a sagittal plane? Now tell me guys, what is the definition, guys, of a sagittal plane? Again, this becomes very easy after that because it is between the two parietal bones. Two parietal bones. So it is an interparietal suture. Interparietal suture. Shashikant, very good. Yes. Now, yes, Sabrina, you are right. Kashmir, you are right. You guys know that a sagittal plane basically divides the body into two parts, the right part and the left part. Similarly, it is based on the suture that is present on the top. Now, you already know on the top we have the parietal bones. If you just want to see, guys, over here, right? If you can just see, this is the posterior view. This is the posterior view of the skull. This is the posterior view of the skull. Yes, Sabrina, you're right. This is the posterior view of the skull. And you already know that this is the right side. Yes, this is the left side. According to the normal anatomical position, this is the right side, this is the left side. Yes, because you're watching the skull from behind. So automatically you already know we have this parietal bones, right? Parietal bone. We also have this parietal bone, the right parietal bone and the left parietal bone. And remember, these two parietal bones are connected to each other with the help of this serrate like sutures. So it is called as the, yes, serrate suture joint, right? These are serrate sutures. And these, yeah, the serrate suture joint, it is present in between the parietal bone. So it is called as interparietal suture. Interparietal suture, right? Interparietal suture. So yes, मैंने बताया था ना, pari is wearing a crown. So pari हमेशा सर के ऊपर पहनती है. So the parietal bones, we have the right parietal, the left parietal, and both are connected with the help of the serrate suture. The bony margins are saw-like, having saw-like edges, right? Crisscross. So I hope the serrate suture is clear to every one of you. Yes, the serrate suture is clear to one of you. Just give me a thumbs up, guys, in the chat box. Now coming on to the third category, guys. Coming on to the third category over here. Yes, Abhijit, very good. Yes. Now coming on to the next one, Spring, Sabrina, very good. Coming on to the next one, that is the squamous suture joints. Squamous suture joints. Suture joints. Now, when I say squamous suture joints, guys, so you have to remember first the definition over here. Yes, remember that one bony edge overlaps the other. One bony edge overlaps the other. Okay. Now let me draw a diagram and explain you guys. Yes, let me draw a simple diagram and explain you guys. Now you guys already know that, let us suppose that this is, yeah, this is the bone 1, right? This is the bone 1, right? And remember, guys, we have bone 2 also over here. Okay, we have bone 2 over here, like this. So see, I've drawn it like very plain, but let me, yes, they are actually overlapping like this each other. They are overlapping like this. So in between, yes, they are overlapping one onto other, and in between, guys, you already know we have the sutural ligament, right? We have the sutural ligament. Yes, the ligament remains the same, the sutural ligament. That's why, guys, these joints are immovable. Okay, they are overlapping with each other, all the joints. They are having fibrous tissue in between. Fibrous is very hard, they will not allow any movement over here. Yes, so guys, remember that the example that you have to remember over here, the example, yes, that is the, yeah, temporo, very good, Abhijit. Yes, it is the temporoparietal suture. Temporoparietal suture. Now, when I say temporoparietal suture, you already know one will be the temporal bone and the other one will be the parietal bone. So we have two bones, guys, right? We have two bones, bone 1 and bone 2 over here, right? So one will be the temporal bone and one will be the parietal bone. Let us just try to look at this image, guys. Now this is the lateral view or the side view of the skull, right? The side view of the skull, and you guys can very well see that this bone, it is the temporal bone, right? The temporal bone, and this is the parietal bone. This is the parietal bone. Now, temporal bone and parietal bone, guys, the temporal bone and the parietal bone, this joint I'm talking about, yes, let me use the black color so to highlight this. Yes, this particular joint, it is basically the, yeah, temporoparietal suture. Yes. Abhijit Sharma, I'm from Darbhanga Medical College. Okay, perfect, perfect, Abhijit. This is the temporoparietal suture. Temporoparietal suture, or in simple words, we'll say it as the squamous suture. Squamous suture joint. It's a type of a squamous suture fibrous joint, right? You already know the one edge will try to overlap the other. Yes. So yes, Moon, you are right. So I hope this is clear. The third example, that is the third one, that is the squamous suture joint, the serrate, the plain suture joint. Right, right, right. Yes. Coming on to the next one, the Springs heart, you are right. The fourth one that we are going to discuss over here, yeah, the fourth one that I am going to discuss over here, the D wala part, that is the denticulate suture joints. Denticulate suture joints. Denticulate suture joints. Now, when I say denticulate suture joints, yes, it is the limboid suture. It is the limboid suture. Now let's first look how it appears, guys. You already know we have bone one, right? We have bone one. It is kind of a lock and key mechanism. If you have heard, one soapbox fit into the other, like the lock and key mechanism in biochemistry. If you have heard about this particular term, so it is just like this, guys. Yes, very, very important. This is bone one and this is bone two. This is bone two, right? This is bone 2. And remember, guys, whenever I'm saying that it is a type of a denticulate suture, basically it will be in between, we will have this sutural ligament, right? We will have this sutural ligament in between, right? So we will have these sutural ligament, right, in between. And yes, very good, Abhijit, very good. The example that we have to focus over here, guys, the example that we have to focus over here, it is the limboid suture. It is the limboid suture. Now, when I say limboid suture, guys, let me just try to show you. You guys already know, let us suppose that this is the skull bone, or let me draw it more easier. Hmm. Yes, over here I'm just trying to draw, and I'm trying to show the posterior view of the skull. You already know we have, yes, the two parietal bones and one occipital bone. So it is between the parietal and the occipital bone. It is between the parietal and the occipital bone. I'm talking about this particular joint, guys. This joint, this inverted, or yeah, this Y-shaped joint, the inverted Y-shaped joint I'm talking about. Yes, this is called as, yes, the limboid suture. This is called as the limboid suture. Okay. Yes, this is called as the limboid suture. If you can just see over here, guys, I'm talking about this particular joint. Yes, between the parietal and the occipital bone, right? This is the occipital. This is the occipital bone. Yes, this is the occipital bone. So this one, it is the limboid suture. This one, it is the limboid suture. Limboid suture. Okay. So yes, it is between the parietal and the occipital bones. Yes. Yes, Kashmir, you are right. So I hope this limboid suture is clear to one and all. The limboid suture is clear to one and all. Now coming on to the last category in this sutural joints. Yeah, the last one over here that you have to remember, that is the shindylesis. Yes. Now be very clear with the spelling. It is shindylesis. Shindylesis, right? Shindylesis. Now when I say shindylesis, guys, yeah, there are two bones. One is the sphenoid bone and one is the vomer bone that is present in the nasal septum, guys, right? So yes, this is the, yes. If you just want to know, it is the cranial part. Okay, the cranial part. Cranial means top part of, or cranial part of the rostrum of sphenoid bone. Okay, sphenoid bone, right? The sphenoid bone. And guys, remember that there is a bone in the nasal cavity. Yes, that is the vomer bone. Yes, yes, you can see. Yes, we have the vomer bone over here. Hmm. Yes, this is the vomer bone. And between the vomer and the sphenoid bone, Yes, we have the sutural ligament in between. Yes. So this is the sutural ligament. And remember guys, yes, this is an example of shindylesis. Vomerospinoidal joint. Okay. The vomerospinoidal joint. Spinoidal joint. Right? Vomerospinoidal joint. Yes, Moon, you are right. You are right, Peter. So I hope these all 5 types are clear to each one of you. Just give me a thumbs up in the chat box, guys, if these 5 types are clear to you. The plain suture, serrate, squamous, denticulate, and shindylesis. Yes, I'm waiting for your thumbs up, guys, in the chat box. Meanwhile, just try to, yeah, fill your flow chart, right? Fill your flow chart, guys. You already know the fibrous joints are classified into 3 categories, right? The fibrous joints are classified into 3 categories, guys, right? Springs, heart, Nulbury, very good. What about rest, guys? Please try to be active in the chat box. Just try to interact with me as others are doing. Yes. Just give me a thumbs up, guys. If it is done, please just try to fill the chat box right now. We have the sutural joints, right? We have the sutural joints, the cartilaginous, yes, the cartilaginous, and we have the, sorry, right, yeah, the sutural joints. Yes, the gomphosis, yes, the gomphosis, yes, and syndesmosis. Hmm. चलो ठीक है syndesmosis and gomphosis. Now, in the sutural categories, yes, in the sutural categories, we have 5 types, right? Yes, we have 5 types. We have already discussed it, right? Yes, the plain suture joints, the squamous, the serrate, denticulate, yes, and shindylesis. And shindylesis. Do not confuse with syndesmosis and shindylesis. They are different, right? So let us now start with the next category. Yes, that is the syndesmosis in case of fibrous joints. Syndesmosis in the case of fibrous joints. Yes. So the next category, guys, yes, that is the syndesmosis. Right. The B1, kind of same. Hmm. हाँ ठीक है. Spring hearts. हाँ ठीक है. Write down syndesmosis. Syndesmosis. Now remember, guys, the syndesmosis, the opposing bony edges or the opposed bony surfaces, the opposed bony surfaces are connected by an interosseous membrane. Are connected by an interosseous membrane. Interosseous membrane. Yes, it is present in the long bones, guys. They are, yes, connected by an interosseous membrane, or I can simply say the interosseous ligament. Okay, so we are talking about it, so you guys should know it is an interosseous ligament. Now, when I say inter means in between the bones. Osseous, yeah, the osseous, the bony ligament is there, right? The bony ligament is there. So examples, yes, the examples, guys, that you have to focus over here. It is the inferior, yes, tibiofibular joint. So remember the examples over here. The first one, the inferior. Why to write the, yeah, the inferior tibiofibular joint. Inferior tibiofibular fibular joint. Now, tibia and fibula, guys, are bones of which anatomical region? They are bones of the lower limb. But lower limb में कौन सा anatomical region है? Yes, just tell me. Yes, I'm waiting for your answers. Yes, Amina, very good. It is the leg wala region. From the knee joint to the ankle joint, we have two bones, that is the tibia and fibula, right? They both are forming. Yeah. Now you already know when I say inferior. Now, guys, you already know. Let me just show you a picture so that it's way clear to you people. Now, this is the tibia, and this is the fibula. This is the fibula, right? Now, when I say inferior, inferior means that the joint it is over here, right? The joint it is over here. Yes, I'm talking about the joint which is present over here. And superior tibiofibular means it is up. So I'm specifically pointing on this inferior tibiofibular joint. Okay, tibiofibular joint. Tibiofibular joint. I will be coming on to the all the parts, all other joints as well. But as of now, the remember in the long bones we have syndesmosis. Yes, if we just try to focus. Yes, if we just try to focus. So you guys already know that this is, let us suppose that this is the tibia. This is the tibia, and yes, let me just draw this, yes, as well. And this is the fibula. This is the fibula. And the lower end, I've drawn the lower end of the tibia and fibula. They are both connected with each other through an interosseous ligament, right? So this is an interosseous ligament that is present in between them. Inter means in between, osseous means bones, interosseous ligament. Interosseous ligament. Interosseous ligament, guys, right? Can anyone tell me any other example? Right. Yes, we have the middle radio-ulnar joint, very, very important. Yes, we have the middle radio-ulnar joint. Radio-ulnar joint. Yes, the middle radio-ulnar joint, again, very, very important. So you guys already know. Yes, we have this ulna, and this is the radius. This is the radius. So they have three joints: one, 2, and 3. So we have the superior radio-ulnar joint, the middle radio-ulnar joint, and the inferior radio-ulnar joint. So again, guys, be very clear with the term that the middle radio-ulnar joint, right? The middle radio-ulnar joint, it is, yes, it is an example of, yeah, the syndesmosis. It is an example of the syndesmosis, right? The middle radio-ulnar joint. Middle radio-ulnar joint. Even the middle tibiofibular joint can be also the example, right? So the middle radio-ulnar joint, this question has been asked in the exam multiple number of times. All the examples are very, very, very important. So that is about the syndesmosis. Yes, मिडिल वाला होगा बेटा कश्मीर एंटीरियर कैसे हो सकता है सुपीरियर ऊपर नीचे इंफीरियर एंड द मिडिल वन इट इज द मिडिल राइट now guys coming on to the next one syndesmosis is also done coming on to the next one yeah the third one guys in this category it is the gomphosis gomphosis as the name suggests gum wala joint right that's present in the teeth right so it is also called as the peg and socket joint. It is also called as the peg and the socket joint. It is also called as, yes, Spring's heart, you are right. It is between the peg and the socket joint. Yes. So it is the articulation. It is the articulation between peg. Now, when I say peg is actually a conical process. Now, I have already discussed the definition of process in my previous lecture. Process means the bony extensions, right? The bony extensions, it is called as peg over here, right? And a deep socket is there, and a deep socket is there, and a deep socket is there. Now, the example, it is very, very much clear. Yes, the example, it is very, very much clear. You guys already know we have, yeah, the tooth. The tooth has these, yes, conical processes, right? This is the tooth, and yes, we have the gum over here, right? Let me just draw this over here like this. Yes, we have this gum over here, right? We have the gum. So yes, it is between the tooth and the gum, and in between we have this sutural ligament, right? Or very specifically, the name over here, it is periodontal ligament. The periodontal ligament, guys, right? The periodontal ligament. It is between the root of the teeth, right? The root of the tooth or the teeth and the bony socket, okay? Where they are connected by this periodontal ligament. It is also called as the fibrous ligament, although they are all categories of fibrous joints, right? So the root of the tooth, it is connected with the gum wala part, right? The bony socket. Yes, and they are connected via the fibrous ligament or the periodontal ligament. So that is about the gomphosis, guys. That is about the gomphosis. So let us just try to complete the flow chart. So yes, sutural joints, 5 types already done, right? Syndesmosis done, gomphosis done. So fibrous joints is completed. Fibrous joints is completed. Syndesmosis done, gomphosis done. Sutural joints done. So fibrous joint is almost all completed. So just give me a thumbs up, guys, if the fibrous joints is done, right? Just give me a thumbs up, guys, if you have done this. You have written all the notes, you have drawn the beautiful line diagrams that I have made for you people, right? And all the important examples that I have shown you guys, right? So just give me a thumbs up, guys, if it is done. Now, coming on to the next category, guys, that is again the next one, that is the cartilaginous joints. Very important. Cartilaginous joints. Again, many times this question has been asked. Many times this question has been asked, guys, right? Now, let us now start with the next wala part. Yes, Kashmir, very good. What about rest, guys? I hope you all are attending the class. Yes, you're writing the notes. Just give me a thumbs up, guys, if it is done. Now, coming on to the next category, medical love. It's okay. Now, please pen down the notes from here, right? Now coming on to the next category, guys, that is the cartilaginous joints. Now when I say cartilaginous joints, now what are the characteristics of these cartilaginous joints? What are the characteristics or the characters of this cartilaginous joints? Now there are some characters that you have to focus on, guys, right? Now the articulating bones. Now, when I say articulating bones, means the bones which are which will be forming the joint, right? The articulation or the joints is the same, right? Yes, you guys are right. Kashmir, you are right. The articulating bones are connected together by are connected together by an intervening cartilage, right? Are connected together by an intervening cartilage, right? Intervening cartilage, right? Huh, huh. Yes, limited movement or no movement. Yes, you all are right, guys. I mean, yeah, the articulating bones are connected together by a intervening cartilage. Apart from that, guys, you have to remember one more point, that there is no joint cavity over here. Again, this also contains no joint cavity. Apart from that, you guys have to also remember that there is no, or simply I can say limited movement, right? Limited movement, it is allowed in the joint. It is allowed in the joint. It is allowed in the joint. No or limited movement, it is allowed in the joints. Yes. Remember, guys, that there are two types of the cartilaginous joint. Can anyone tell me the names of the two types of cartilaginous joints? Yes. Hmm. Remember, guys, that there are two types of cartilaginous joints, right? two types of cartilaginous joints. Yes, there are two types of cartilaginous joints, guys. Remember, we have the primary cartilaginous joint and the secondary cartilaginous joints. The primary cartilaginous joints and the secondary cartilaginous joints. Yes, yes, spring hearts, very good. Kashmir, very good, beta. Very good. Secondary cartilaginous joints. Secondary cartilaginous joints. Two types out there. So let us just discuss one by one both the cases, one by one both the types, right? The very first one that we are going to study, yes, we have the primary cartilaginous joints. Primary cartilaginous joints. Now, this primary cartilaginous joint, it is also called as synchondrosis. Yes, Moon, you are right. I think one of you have also said that synchondrosis. Yeah. Yes, Kashmir, you only told that. So remember, it is also known as, okay, it is also known as synchondrosis. Synchondrosis. Now, when I say chondro, beta, again, it makes a sense. Syn is basically connecting those things, right? Chondro means cartilage, right? now, now, guys, let us just try to understand this with the help of a diagram. You guys already know. Let us suppose that this is bone one. Yeah, this is bone one, and we have bone two also. Bone two also. So this is bone one and bone two, right? Now this is, I'm not classifying it as bone 1 or 2. I will tell you the reason, guys, why. And remember, in between this, we have this cartilage. And this cartilage, beta, and this cartilage, it is called as the hyaline cartilage, right? They are connected together by an intervening cartilage, right? So this is the, yes, hyaline cartilage, which is helping in the joint, or yes, through this, basically, the bones are connected. This is the hyaline cartilage, right? Now, guys, now parts of the long bones. Let us just try to, yes, you guys already know that we have again drawn this. This is the epiphysis, right? This is the epiphysis. Okay. Then we have the growth plate. Let me just draw this growth plate, and then we have, yes, then we have the metaphysis and the diaphysis, right? You already know we have drawn this, yes, multiple number of times. You already know this is the metaphysis. Metaphysis, yes. And this is the diaphysis. This is the diaphysis. Now, guys, example. The very first example that I'm going to tell you, it is the growth plate. Okay, it is the growth plate. The example number one that you have to remember, the growth plate, or I will also say it as the epiphyseal plate. Epiphyseal plate. Now, you guys are going to answer this question. You already know that this growth plate, okay, or this growth plate, I have already told you it is made up of which cartilage, guys? It is the hyaline cartilage. Now, after a certain age, this cartilage will transform into bone. This part, this yellow color will transform into bone. So again, can I say that this joint is a primary joint? I mean, this is a temporary joint, guys, right? This is a temporary joint because this hyaline cartilage, as you already know, the growth will take place. This growth plate, I mean, the hyaline cartilage will transform into bone, and after that, the growth will stop, right? So obviously, guys, these joints, very important. These joints are temporary joints, right? So this hyaline cartilage, you already know, it ossifies with age. Ossifies means it will convert into bone, right? It will convert, this yellow color will convert into bone, and these two bones will join together as one, right? So yes, so this is a kind of a temporary joint, right? This is a kind of a temporary joint, right? Ossifies with age and forms bone, and forms bone. So remember, this hyaline cartilage will ossify, it will convert into bony part, and again, yeah, it is a type of a temporary joint. It is a type of, yeah, yes, Kashmir, yes. In adults, it's not seen. In adults, it's not seen. So this has no, again, two important points that I have to discuss over here, guys. This primary cartilaginous joint has no joint cavity, right? And there is no movement. It does not allow any movement. Okay. So it is a temporary joint in adults. It's basically disappears in adults. Yes, you are right, by ossification, right? So that is about this. Apart from that, we have costochondral joints also. The second one, it is the costochondral joints. The costochondral joints, right? It is between the costal ribs and the costal cartilage, right? Some part will again transform into joints, right? The costal ribs and the costal cartilage. Virtual reality, what you want me to teach after general anatomy? Please let me know. Upper limb, upper limb, head and neck, neuro. Just let me flood the all the videos with the comments. Okay, after this, in all the parts, just write down what you guys want me to teach next. Right? Everything. Okay, I will be teaching one by one. The very first topic that you guys want me to start after this. So that is about the primary cartilaginous joint, right? Now coming on to the next category, guys, the next one, that is the secondary cartilaginous joint. The second one, that is the secondary cartilaginous joints. Cartilaginous joints. The secondary cartilaginous joints. Now, when I say secondary cartilaginous joints, guys, remember that these joints are also called as, okay, these are also known as, yes, symphysis, spring hearts, all the examples are correct. It is also known as the symphysis. It is also known as the symphysis, right? Many of the times in abdomen lectures, if you go through all the abdomen lectures that I have taught, might be using the term pubic symphysis. Now I will tell you what is symphysis, guys. I will tell you what is symphysis. So yes, now remember the opposed surfaces of the bony articulating or the articulating bones. Yes, spring hearts, Kashmir, you are right. Of the articulating bones, they are connected by they are connected by a disc of white fibrocartilage, white fibrous tissue, very very hard. So again, guys, tell me, guys, will there be any movement if there is fibrous tissue present over here? Chalo, yes or no comment karo. Will there be any movement, guys, if there is any fibrous tissue over here? So obviously they are having no movement, right? Sure. Obviously they are having no movement, right. Sure. Now guys, let me just draw an diagram for you. You guys already know that. Let us suppose that this is bone 1, right? This is bone 1, and yes, let me draw bone 2. This is bone 1. And correspondingly we have this bone 2 also over here, right? This is the bone 2. Bone 2. Remember, guys, that the ends of these bones are having hyaline cartilage. The articulating part, they are having hyaline cartilage. So in this blue color that I have drawn, this is the hyaline cartilage, guys. This is the hyaline cartilage. But in addition to the hyaline cartilage, in addition to the hyaline cartilage, you guys will see, yes, you guys will see another tissue that is present over here. Yes, the another tissue that is present over here. Yes, in addition to the hyaline cartilage, you guys will see the fibrocartilage. Yes, this yellow color, it is the fibrocartilage, guys. Now, what is the difference between the primary and the secondary? The primary ones are temporary, guys. Now, this fibrocartilage will never ossify with age, right? It never ossifies, guys. It will never convert into bone, right? It will never convert into bone. It never ossifies. That's why, guys, it is called as a permanent joint. It is called as a permanent joint. Very, very important. Yes, it is called as the permanent joint, guys. Very, very important. It's called as the permanent joint. Okay, so when I say permanent joint, guys, it simply means that they will remain throughout life. It will remain throughout life. It will remain throughout life. So it remains throughout life. Okay, now, guys. Now there is limited movement, guys, by the compressibility of the no disc. So if you guys will ask me, see the we have some cartilaginous disc. There is very, very limited movement of these joints. So that's why this comes in the category of no movement or some movement, no movement or some movement. For example, guys, all the joints in the midline, all the examples are very, very important. They have been asked in the exam multiple number of times. Very, very, very important. All the examples, guys. जितने डॉलर लगाने उतने लगा लो. Multiple dollar signs on this particular part. Now, the very first one, guys, that you have to remember, we have the manubriosternal joint. Manubriosternal joint. Manubriosternal joint. Now, when I say menubrio, okay, let's pen down all the yeah, all the joints, the examples. Ziffy sternal joint. Ziffy sternal joint. The third one, intervertebral disc. Intervertebral disc. The fourth one, pubic symphysis. Pubic symphysis. And the fifth one, sacrococcygeal joint. Sacrococcygeal joint. So we have manubriosternal joint, xiphisternal joint, intervertebral disc, pubic symphysis, and sacrococcygeal joint. And sacrococcygeal joint. Yes. Now, guys, let us just try to look at this. I have a very beautiful picture in front of me, and this is the picture of the thoracic cage. And this part, guys, you already know this bone. It is called as the sternum. This is called as the sternum. Now, this sternum has three parts. Let us just try to understand in a very simple diagram, guys. Yes, the sternum has three parts, guys. Right? Can anyone tell me the name of the three parts, guys? The sternum has three parts. Can anyone tell me the name of the three parts? Hmm. Hmm. Now, guys, you already know this part. It is called as the manubrium. Yes, the manubrium. Then we have the body of the sternum, and then we have the xiphoid process. The xiphoid process. Right? We have the three parts. Yes, Kashmir, Wahid, Hina, Kashmir. Yes, you guys are right. You guys are absolutely right. Yes. So we have the manubrium, body, and the xiphoid process. Hina Passer, yes. Now, guys, you already know between the sternum, between the manubrium and the body, this joint, it is called as the menubrio. Again, the name menubrio, sternal joint. Manubrium. Okay, so you have to omit um, menubrio sternal joint. Now again, this joint between the body of the sternum and xiphoid process, Ziphisternal joint, okay, Ziphisternal joint, right? Ziphisternal joint, Sabrina, yes, you are right. Ziphisternal joint. So, yes, so you can see this joint, that is the, yes, manubriosternal joint, right? This is the Ziphisternal joint. Again, guys, you can see the vertebrae over here, the vertebrae, right? The vertebrae. In between the vertebrae, guys, yes, the intervertebral disc. Inter means in between. Intervertebral disc, okay, the intervertebral disc, so they can compress also, so they have very limited movement, guys. That's why they have very limited movements, guys, right? So intervertebral disc. Coming on to the next one, guys, you already know we have this, yes, let me just show you. You already know we have the sacrum and we have the coccyx. Sacrum, the sacral vertebra, and the coccyx. You already know we have two vertebrae, right? The sacrum. Yes, can you see the sacrum and the coccyx? The sacrum and the coccyx. Between the sacrum and the coccyx, sacrococcygeal. In adults, we have one sacrum and one coccyx, right? We have 26 vertebrae, guys. We have 26 vertebrae because in adults they are fused. In adults they are fused. So it is called as the sacrococcygeal joint. It is called as the sacrococcygeal joint, guys, right? So again, it is in the midline. If you can see the manubriosternal, ziphisternal, intervertebral disc, and this sacrococcygeal, all the joints are in midline. Now, coming on to the next very important, that is the pubic symphysis. I don't know how many times it has been asked, but the multiple number of dollar signs you can make on this question. They have given an X-ray, they have given simple diagram, they have given like simple, they have asked pubic symphysis is a type of which particular type of joint. So again, you guys have to know that it is a type of a secondary cartilaginous joint. Secondary cartilaginous joint. Now, what is pubic symphysis, guys? You already know we have the hip bone, right? We have the hip bone. Hip bone are basically two in number, the right hip bone and the left hip bone. So the hip bone has three parts. We have the ilium, ischium, the lower part, and the pubis, right? Yes, we have the pubis over here also, the ischium and the ilium. So the pubis, the right pubis bone and the left pubis bone, they are meeting together in the midline of the body and symphysis the secondary cartilaginous joint. So this joint, guys, they have asked in X-ray also. If you know that this is the pubis, it is meeting in the midline. It is called as pubic symphysis. It is a type of secondary cartilaginous joint. Secondary cartilaginous joint, right? So you guys have to remember that mostly the most of the midline joints, except the sutures, serrate sutures and all, so the one which is coming below the neck wala part, the manubriosternal, ziphisternal, intervertebral disc, pubic symphysis, right? All these joints are secondary cartilaginous joints. Okay, they are temporary joints, right? They remain throughout life, right? So this is about the secondary cartilaginous joints. Very important. So I hope this is clear to one of you. So please just complete the flowchart as well. So we have already discussed the secondary cartilaginous joints. So this is the primary and secondary. Primary and secondary. We have two types of cartilaginous joints, primary and secondary. So I hope this is clear to each one of you guys. Just give me a thumbs up in the chat box if we are done with the fibrous and cartilaginous part. Now coming on to the third part, that is the synovial joints, guys. Coming on to the third part, that is the synovial joints. Very important. Synovial joints in question हमेशा आता है. Many of the times you will see this question. Yes. You spring hearts, you have written all very good. Hina Kausal, very good beta. What about rest, guys? I hope you all are there. Yes, you all are there. Hmm. Yes. Now, yes. Pubic symphysis, it's a permanent joint, it will remain, guys. In us also, in adults also, it is there, right? So now we are going to start with the synovial joints. So please put the heading as structure and characteristics. We will be discussing both the things together over here, structure and characteristics, and the characters of the synovial joints. Very important. Yes, the structures and the characters of the synovial joints. Now, now guys, let us just try to see over here. You guys already know. Let us suppose that this is bone 1, right? This is bone 1, and yes, we have bone 2 over here. We have bone 2 over here. Yes, this is bone 1 and we have bone 2 over here. So this is bone 1, bone 2. Sure. Bone 1 and bone 2 guys, right? Now, the articulating surfaces. Now you guys, you already know the articulating surfaces are the ones which will participate in the joint formation, which will participate in the joint formation. Or let me draw it more clear guys to you people. We'll draw the same diagram just to make it more yes. Hmm. Yeah, let it be in this way. Yeah. So, can anyone tell me that the ends will be covered by with which cartilage guys? Bone 1, and let us suppose this is bone 2. Bone 2. Yes, the bone 2. Now, you guys already know the ends. Yeah, over here the cavity movement, everything will be present. All the characters you guys already know. But let's first discuss the structure wala part also. You already know that the articulating surfaces are covered by a cartilage that is called as the articular cartilage guys. That is called as the articular cartilage, or simply we can say that this is the hyaline cartilage, right? This is the hyaline cartilage. So this is the, yes, articular or the hyaline cartilage. The articulating surfaces, they are covered by this articular or hyaline cartilage, right? The ground glass cartilage, the ground. Yes. Now, this hyaline cartilage over here, or the articular cartilage which I'm talking about, it is very smooth, guys. It is very smooth. It is compressible, okay, and highly resistant to wear and tear. Now, the three important things over here about this hyaline cartilage, that it is highly smooth, okay, it is highly smooth. Now, apart from that, you guys should know it is compressible also over here. It is compressible and it is highly resistant. Okay, it is highly resistant to wear and tear. Yes, highly resistant to wear and tear. Right? Now, now the articulating bony ends, guys, over here. Okay, let me just draw up till here. So please cover the articulating part completely, right? The articulating part completely. Now the articulating ends, guys, the articulating bony ends, remember they are covered by, right? They are covered by, yes, ACPL, anterior cruciate ligament, posterior cruciate ligament. Yes, yes. जहां से नो नो बेटा, जहां से नहीं, आर्टिकुलेटिंग पार्ट पे पेरियोस्टियम नहीं होता है, ठीक है? आई ऑलरेडी डिस्कस्ड इन दैट वाला पार्ट, आई मीन द प्रीवियस लेक्चर्स, राइट? So, Moon, you are right, but again, just try to see over here. The articulating ends are basically connected by a tubular fibrous sheath. Okay. Now let me just draw it, guys, over here. Yes, they are connected by, okay, the tubular fibrous sheath. Okay, this is also known as the fibrous capsule, right? This is also known as the fibrous capsule. Now this capsule, okay, are, it is composed of no collagenous fibers, right? It is composed of collagenous fiber. Now, when I say collagen, guys, you already know collagen is of high tensile strength, right? Strength wali cheez ki baat kar rahe, collagen, right? So this capsule, which is covering the bony end from the sides, it is actually It provides strength, guys, right? So it is fibrous sheath, right, which is composed of collagen fibers, right? Now, this fibrous capsule, guys, remember, yes, spring hearts, yes, Shashikant, very good. Now, this fibrous capsule, it is lined by, very, very important, it is lined by the synovial membrane. Okay, it is lined by the synovial membrane. Yes, this is the synovial membrane, guys. It is lined by the synovial membrane. Now, this synovial membrane will line internally, okay, the whole interior of the joint. It will occupy the whole the interior of the joint except the articular surfaces. It is absent at articular surfaces, guys, right? And also, it is also absent at interarticular disc. Yes, interarticular disc. Now, interarticular disc, it is also called as meniscus, right? The menisci, right? Again, guys, you have to remember that there is something called as the joint cavity which is present, right? The joint cavity, it is present in between. Okay, the joint cavity, it is present and it contains a fluid, guys. Okay, can anyone tell me the name? Yes, the name of the fluid, guys, over here. The name of the fluid. Yes. Yes, the joint cavity contains one fluid that is called as the synovial fluid, guys. That is called as the synovial fluid, right? Now, the synovial fluid, beta, remember, it is a lubricant. It is a lubricant, okay? Now, this lubricant fluid, okay, this lubricant fluid, it is basically secreted by, okay, it is secreted by synovial membrane only. It is secreted by, yes, everyone is right. Spring Hearts, Kashmir, Dr. H, very good. It is secreted by the synovial membrane only. So, yes, we have the two articulating surfaces covered with the hyaline or the articular cartilage, which is smooth, compressible, and highly resistant to wear and tear. Otherwise, we have on the sides, we have the fibrous capsule, which is composed, which is a tubular sheath. Okay, the fibrous sheath basically composed of collagenous fibers, and internally lining, we have the synovial membrane, which is absent at the articular part and the interarticular disc, which secretes a fluid known as the synovial fluid because there is a joint cavity and this synovial fluid is a lubricant. Okay, now I hope this is clear, guys. Just give me yes, yes. Just give me a thumbs up in the chat box, guys, if this is clear to everyone. Now, these capsules, these fibrous capsules, no guys, can also contain minute openings, right, through which the synovial membrane can come out, and that is something called as the synovial bursa, right? This is called as the synovial bursa. I will be discussing bursa day after tomorrow, right? I will be discussing the synovial bursa, right? Right. So that is you have to remember. Yeah, okay. Hina, very good. Spring's Heart, very good. Kashmir, very good. Now, guys, again, you have to remember one more important thing over here, that the nerve supply over here basically follows the Hilton's law. Okay, I have already discussed the Hilton's law before. The nerve supply of the joints basically it follows the Hilton's law. Apart from that, guys, if we talk about the blood supply, guys, okay, the arterial supply of the synovial joints. So there is anastomosis present between the arteries that actually supply the joints, okay, the anastomosis, okay, around the joint, anastomosis around the joint that is present. Now, when I say anastomosis, you guys already know, yep, yes. So it is the meeting point of two different arteries, guys, right? Two or more arteries basically they meet at a point and they will also supply the joint, okay, over there. Apart from that, again, guys, remember one very important thing, the blood supply, it is absent over this articular cartilage, okay? The blood supply is absent. You already know the cartilages are avascular. The cartilages are avascular, guys, right? Now, Now, I hope this is clear to one and all. Just give me a thumbs up, guys, in the chat box. I hope this is clear to one and all, guys. Hmm. Love story, videos, and music. Perfect. Sure. Now let's discuss about the classification. Yes, yes, beta. Now let's discuss about the classification. When I say classification, guys, I'm talking about the types of the synovial joints. Types of the synovial joints. Now, the classification, okay, can be based on various categories, right? It can be according to number of articulating bones, number of articulating bones. It can be, yes, according to shape of articulating bones. Okay, it can be according to the shape of articulating bones. And the third one, guys, it can be according to the axis of movement. According to axis of movement, right? It can be according to the axis of movement. Now, we are going to discuss about only one category from here, that is according to the shape of the articulating bone, the one which is important and in the syllabus, right? The one, yes, according to the shape of the articulating bones, right? So remember, yeah. Hmm. So yes, we are going to discuss classification based on the shape of articulating bones. The shape of articulating bones. Spring Heart, thank you so much for the comment. Yeah. Now, the very first one, guys, that we are going to discuss over here, it is the plain, yeah, synovial joint. Okay, the plain synovial joint or the plain joint, or also called as the plain synovial joint. The plain synovial joint. The plain synovial joint. Now, remember that the articulating surfaces are flat over here. Nearly all the articulating or the opposing articulating surfaces of the joint bones are basically flat. Okay, they are flat, right? And remember, the movement, it is permitted only in one sliding direction. Okay, movement only in sliding motion. Only in sliding motion, right? Only in sliding